Hi, everyone. We're back with another podcast, and I am Katharine with Healing Through Awareness. And today we are talking to Dr. Katy Koukouras with Sky Valley Healing Art. Hello, Katy.
Hello.
There you are. Now that I can see you, we can address what you do and where you're located.
So I'm a naturopathic physician, and I'm an acupuncturist, and I'm located in downtown Snohomish, right off 2nd and D, in kind of a big brick building. Our sign's out front. We've been here for a little while. Been in downtown Snohomish for a while too. Well, first, let me just say that please don't take anything I say as medical advice. It's always good to contact your doctor and ask about anything I say here, whether it be simple as a vitamin or something else. It's always good to check because, not everything is good for everybody. I had mentioned that because I had felt like, COVID is something very real to all of us right now, and I had gotten a lot of questions about nebulizing treatments. Could you nebulize things? And I just thought it would be good because I had so many questions from my patients that it would be good, as we talked about COVID, to mention something about, don't take everything off the internet as, oh, I should go home and do this. Nebulized treatments can be really helpful for people, and we nebulize sometimes different things. But one thing a lot of my patients had heard about was hydrogen peroxide, and that they were they were curious about buying a food grade hydrogen peroxide and going home and nebulizing it. And I think that can be really dangerous. So it was just one thing I thought would be good to talk about as we talked about COVID, about, I would hate for somebody to go think that would be healthy for their lungs. And so I wanted to talk a little bit about nebulizing and the criteria for that. Always talk to your doctor, first of all, but nebulizing is something that should be just done with sterile components. And so nebulizing anything with, that you can't make anything sterile at home, right? None of us really realistically probably have that capability.
So with a patient or a client that came in and you have been actively doing some naturopathic treatment with,
yeah,
and whatever they're in for, whatever they've come for in treatment, and it's then compacted, that's not the word I want, compromised or something, with all the fear of the COVID thing, how do you marry
that? Well, I think we'll check in about how they're feeling mentally, right? Because this has affected people, even if they haven't been exposed to COVID or had COVID. I think this is affecting people in lots
of worry.
Ways,
yes.
Right? The worry, the relationships within their family are different because everybody's stuck at home or everybody's working away and there's added stress. And so I think, with most patients, not with most, but there are some that I've done some added things around that where they've never needed support in that area before. Maybe now they need some support in that area. So we've focused on things that can kind of help to.
So specifically, what would that look like?
Oh, it depends. I think this is the hard thing about naturopathic medicine, but it's the beautiful thing about it is it depends because everyone's different. So like if somebody had, let's say, sometimes I'll run genetic profiles on people and we'll look at something called a methylation pathway. And that can be a pathway in which we make a lot of different neurotransmitters. And sometimes genetics isn't 100% of who we are. I always it's hard to attribute a percentage to it. I always say 30. It's varying, right? But our genetics can come into play sometimes. And if you have a harder time making some specific neurotransmitters, you may not notice it most of your life until stress comes in. And maybe you're using up some of those cofactors that you're using. And so we need to support those specific cofactors, because higher stress does utilize different nutrients than when you're in a low stress situation. And sometimes that can tip the scales into a positive direction with the neurotransmitters, and then people can really, really notice a difference. So somebody might be we've already gone through that profile and we've looked at it and we've said, okay, they're not having any problems right now, but when problems come up, we can revisit it and say, oh, most likely it's that you're not making enough of this. Let's try and add a little bit of this B vitamin in, or something along those lines. Of course, there's always counseling that we can refer to for more in-depth help. But a lot of the times when the body's stressed, a lot of times there's some really specific nutrients that we can do to kind of support that a little bit more.
So speaking of, I'm going to kind of wind us back a little bit into the pain issue, because whether it be physical pain from body changes or an accident, or I want you to speak to some of the injection therapies for pain. What does that look like? What should somebody expect if they wanted to initiate that kind of treatment?
So they're all, they're all really different ways of treating pain. So I'll kind of talk about them all in general. And then, sometimes one is more appropriate for a condition than another. And that's where I feel like myself or a doctor would be able to, or another doctor, right, would be able to help guide that decision if they're knowledgeable in that area. So I wouldn't expect somebody to come in and say, I know exactly what I need.
Right. But although people do that, I'm sure.
Yeah. But in general, there's this, it's interesting. It kind of, there's a couple of different injection techniques, and a few of them go on kind of a pro-inflammatory idea. And that's so counterintuitive to what we've all been taught for so long, is anti-inflammatory. Get down the inflammation, right?
Right.
And a few of these injection therapies that really prove to be, that can be really quite effective for people, are based on kind of a pro-inflammatory. They aggravate the area a little bit. They call in kind of stem cells or growth factors and things to come into the area and give it some attention, is kind of how I think about it. And so it's like focused inflammation that we're asking for. And so sometimes with some of the injection therapies, somebody can be quite sore after, because we're actually inflaming them in the area that we're injecting.
To get the body to work on that spot. Is
exactly.
that what I'm hearing?
Yeah. So, unchecked kind of systemic inflammation doesn't seem to be great for most people, right? Or really anybody. But it seems as though when we aggravate an area with some sort of, there's different things that we're actually injecting, but even just the needle poke, right? It can aggravate the area. And basically, the way I think about it is it sort of calls attention to it, and the body comes in to re-heal it. And the way I think about it is like, if we think about like a surgical scar, if the body, when you first get that scar, the body really wants to just close it up. It closes it up as fast as possible. So pre-scar, really, right after the incision, The
right?
body's just going to try to close it up as quickly as possible. And it's really about, the healing is about protection and trying to, it's like somebody's trying to get in your door and you're trying to shut the door. You don't care how you shut it. You don't care what gets caught in it. You just try to shut the door, right? And the way I look at this sometimes is, maybe if we're working on a scar, that now we don't have to shut the door. The door is closed. Now we're cleaning up the edges, essentially. We're calling attention to the area again, but not in an emergent situation. And it seems to work well for the body. It seems to really provide pain relief. Not usually initially. Initially, it's usually a little painful. But it really seems to allow the body to come in and re-heal the area in a non-emergent way. And there's more, it seems to be something that, doesn't create as much scar tissue and creates less pain and more movement if we're trying to get movement out of it. So that's kind of the goal. And it's, I always think it's different than we all think. Right? We think anti-inflammatory, inflammation's bad, but inflammation isn't all bad.
No, it's definitely directing the body and awareness.
Yes, exactly. Yeah.
So if someone is or has been taking anti-inflammatory type of, whether it's over the counter or prescribed, is that something that they can slowly come off of with these kind of treatments, possibly?
Yeah, so that would be the goal, right? Is that they don't have to manage their pain with something that's maybe doing them some harm also.
Right. Well, that's pretty exciting, actually, because I don't think there's a person on the planet that doesn't have some sort of pain.
Yeah, and it seems to be fairly effective for a lot of people. It depends on what the injury is. It depends, there's a lot of, it depends, right? And how we go about addressing it. But it does seem to be fairly effective. It's usually not a one treatment and you're done. But it's also usually not ongoing. So there usually is an endpoint. I always tell people, give it 4 to 6. And
see how it goes. Yeah.
And some people feel great after 2, but I don't always know that that's the most realistic expectation. So
right. Do you, with the different types of injection therapies, do you couple that with your acupuncture at times?
Yeah, sometimes. It depends exactly how we're doing it and what we're doing it for, and how I need the person to lay too, because with the injection therapies, a lot of times I'm moving them around or they're moving, as I'm doing it, and that's a little harder with acupuncture. So it just depends if it's possible or not a lot of times, or if the person wants it. Sometimes they, I always think, they're not huge needles. They don't hurt a ton, but sometimes there's a limit to how many times somebody wants to be poked too, right?
Well, and speaking to that, if, say, you have someone call you and they're at their wit's end and they're not real strong proponents of having needles, and so there's fear around that, how do you help them move out of the fear into understanding that it possibly could be very helpful for them if they try the acupuncture and or the injection therapy?
I usually try to talk about the level of pain. It's usually different than if they've never had acupuncture before. It's, a lot of times people don't even feel the needles. So you know, there are more aggressive and less aggressive acupuncture needling techniques and injection techniques. And so depending on what it is we're injecting and where we're injecting it, there's we can really help to show them that the needles don't necessarily have to be painful all the time. And there are some therapies that their pain comes with it occasionally. But I would say, like in the case of acupuncture, there are some ways we can do it where people don't really notice that the needles are in. They don't feel like needles. They're not sharp. They don't go in and feel like, oh, I feel like I have a needle in me. And the acupuncture needles are especially easy to do that with because they're really small. They don't need to have a hollow center, so they're tiny little things. And a lot of times they're really comfortable for people. Acupuncture also gives, there's an endorphin release with it. So
Well, that would be lovely.
yeah, so people feel kind of good afterwards a lot of times. I always equate it to that runner's high that you can,
the euphoria.
yeah.
Right.
People feel really good after acupuncture. And so usually, even with people that are nervous about needles, if they can get over it, usually it's getting over that first time and actually trying it once.
Yeah.
But if they can, they usually keep coming. There's a lot of different styles of acupuncture. The traditional is traditional Chinese medicine. I was really interested in also learning more about 5-element acupuncture, so I did a separate course to expand my knowledge in that area as well. And then, you know, other things having to do with naturopathic medicine and learning more about kind of how, you know, as you expand your practice, you realize, oh, there's holes, or I'm really interested in this. This is something I really want to look into a little bit more in depth, and or I feel like I can help people up to this point, but what about the genetic piece of it? So that's another thing that I've looked at more and gotten more training in.
So, as in your background as a naturopathic doctor, the genetics and the injection therapies, that's just something that you meld in with your acupuncture, or is it a complete separate treatment?
I would say it's a complete separate treatment.
So how would somebody address if they called in and said, I don't know much about the genetics therapies, but how would you speak to that?
Generally, you know, I would say most people call in either looking for acupuncture or naturopathic medicine. And then once we get things started and I get to know their history and I have a good idea of where we need to go next, or if something's not working, then I would start maybe to introduce, if I feel like they're a good candidate, oh, there's this therapy that might really help that.
Oh, so it's all part of the early on intake and an appointment or two to kind of get a feel for that?
Yeah, I would say, you know, if somebody strikes me right off the bat that I feel like it would be a very good candidate, it could be in the first appointment that I'd suggest something along those lines. It just depends, you know, each person is different and each story is different. And I always kind of look at it like a knot that we're untangling, and you never know what that first piece you need to take out is. So I just try to follow their lead, essentially, right?
That's excellent. So if with the phase 2 and the movement that's happening now, things opening up, your protocol for someone coming in just follows those phase 2. I'm losing the word on that, but you know what I mean?
Yeah.
Just to speak to it a little bit to make people feel a little less fearful, a little more comfortable if they want to come in and have a, so to speak, a face-to-face appointment.
Yeah, so yes, we, the reason I don't have more people working in here is because of exposures. I think they can do, it's not exactly the same as having somebody in office answering the phones, but they can do their jobs, right, at home much
Yeah.
better, and safer. And yeah, we're taking a lot of precautions. I'm really trying to minimize the people that walk in the door. And doing
As
most
in walk in the door unannounced or walk in the door in general?
in general, like
Okay.
having fewer people in the office. Um, if I do have to have a couple people back to back, they don't overlap, right? I take them back right away. I will use different rooms for people. We sanitize in between, but I think there's also the issue with air circulation and that kind of thing. So I'll use different rooms if people are coming in back to back, and just trying to keep people separated, essentially.
That's good. It's good information. I think that's some of the base information that relieves fear for people.
Yeah.
So I want to kind of bring this full circle, but I have one more question around this. Do you treat younger people, children?
Yeah.
And what's your age bracket that?
Oh gosh. I don't treat babies, little tiny babies. But basically 1 year and up, and I don't have an upper limit. So kind of, I think of it as kind of all ages. Um,
Nice.
you know, I, um, I think what I do well is, what I've always loved about medicine is trying to figure something out. I like trying to solve a problem. I enjoy it. It feels good to my brain, for lack of a better way to describe it. And so I think what I do best is that I try to figure out the answer to an issue. And
Do you find talking to kids to try to figure out the answer easier than adults?
it depends. It
Do they
depends.
talk freely about how they're feeling?
Yeah, they talk freely about how they're feeling. Um, sometimes, sometimes kids don't have the words to describe it though. So it just depends.
Yeah.
I would say I've met kids that are great at describing it and kids that aren't great at describing it, and same with adults. Some
Yeah.
adults can't tell you what's going on exactly, or describe what they're feeling, and some adults just nail it too. So it's hard to say.
Well, on that note, I want to say it has been fabulous, very lovely talking with you, and very informative. I actually learned quite a bit.
Oh, thank
That
you.
is delightful, and I hope that you feel that maybe another moment you can speak deeper to more of what is going on. And thank you for being with us today.
Yeah, thank you for having me.
That is awesome. For those out there, once again, we're speaking with Dr. Katy Koukouras. No, I got that wrong, didn't I?
Okay, Koukouras.
Koukouras at Sky Valley Healing Arts. Give her a shout if you need some help. She is awesome. Thanks, everyone. Thank
Thank,
you, Katy.
thank you.